Good afternoon, Father.
ವಿಡಿಯೋ ಅಂತ ಹೊರಗೆ ಬರುತ್ತೆ.
ಕಾಣಿಸ್ತೀನಿ ನಾನು ನಾರ್ಮಲ್ ಕ್ಯಾಮ್ರಾದ ಚೆನ್ನಾಗಿ ಕಾಣಿಸ್ತೀನಿ. ಸ್ನೇಹ ಯೂಟ್ಯೂಬ್ ಲೈವ್ ಆಗ್ತಿದೆ. ಅಯ್ಯೋ ನಾನು ಏನೂ ಪ್ರಿಪೇರೇ ಆಗಿಲ್ಲ. ಅಯ್ಯೋ ನಾನು ಪ್ರಿಪೇರೇ ಆಗಿಲ್ಲ.
It's okay. It's okay.
Sneha, you let me in, huh?
Madi, you just mute your this one.
One second.
Te dedo.
ಓಪನ್ ಮಾಡ್ತೀನಿ ಅದು
ನಾಳೆ ಹೌದು ಅವನ್ನ ಗೊತ್ತಾಗ್ತದೆ
Good afternoon to one and all present here. On behalf of Darshan College Women Empowerment Cell, I cordially welcome you all to this national level webinar on awareness on polycystic ovarian deficiency in women. Myself, Bhagyalakshmi of 5th and BCom. It's my pleasure to be a moderator for today's webinar. A day without prayer is a day without blessings. With this, I call upon Lalita V. Naidu of 5th and BCom to lead us in prayer.
ಈ ಜಗಕ್ಕೆಲ್ಲ ಬೆಳಕಾಗಿ ಬಾ ದೇವ, ಇಲ್ಲಿ ಬೆಳಕಿಲ್ಲ ನೀನಿಲ್ಲದೆ. ಈ ಜಗಕ್ಕೆಲ್ಲ ಬೆಳಕಾಗಿ ಬಾ ದೇವ, ಇಲ್ಲಿ ಬೆಳಕಿಲ್ಲ ನೀನಿಲ್ಲದೆ. ನಮ್ಮ ಬದುಕಿನ ಹಗಲಲ್ಲಿ ಬಾ ದೇವ, ಈ ಹಗಲಲ್ಲೂ ಏಕಾಂತವೇ. ಹೊತ್ತು ಹೋಗದು ನೀ ಬರದೆ ಈ ಬಾಳಲ್ಲಿ, ಕತ್ತಲಾಗದು ಈ ಬದುಕು ನೀನೆದ್ದಲ್ಲಿ. ಈ ಜಗಕ್ಕೆಲ್ಲ ಬೆಳಕಾಗಿ ಬಾ, ಇಲ್ಲಿ ಬೆಳಕಿಲ್ಲ ನೀನಿಲ್ಲದೆ. ಈ ಹಗಲಲ್ಲೂ ಬೆಳಕಾಗಿ ಬಾ ದೇವ, ಇಲ್ಲಿ ಬೆಳಕಿಲ್ಲ ನೀನಿಲ್ಲದೆ. ನೀನಿರದ ಮನೆಯಲ್ಲಿ ನಾನ್ಯಾರೋ, ಈ ಮನೆಯ ಹಂಗೆ ತಕೋ. ಮನೆಯ ನೀನಿಲ್ಲದೆ ಒಳಗೆಲ್ಲ ಹುಸಿ ಬದುಕು. ನಡೆಯಲ್ಲಿ ನುಡಿಯಲ್ಲಿ ನೀನಿಲ್ಲದೆ ಬಹಿರಂಗ ಚೆಲುವೆ ತಕೋ. ನಡೆಯಲ್ಲಿ ನುಡಿಯಲ್ಲಿ ನೀನಿಲ್ಲದೆ ಬಹಿರಂಗ ಚೆಲುವೆ ತಕೋ. ಆಕಾರ ನಾನು ಸಾಕಾರ ನೀನು, ನನ್ನಲ್ಲಿ ನೀನಾಗಿರು. ಈ ಜಗಕ್ಕೆಲ್ಲ ಬೆಳಕಾಗಿ ಬಾ ದೇವ, ಇಲ್ಲಿ ಬೆಳಕಿಲ್ಲ ನೀನಿಲ್ಲದೆ. ನಮ್ಮ ಬದುಕಿನ ಹಗಲಲ್ಲಿ ಬಾ ದೇವ, ಈ ಹಗಲಲ್ಲೂ ಏಕಾಂತವೇ.
Thank you, Lalita. It's time to welcome. Now, I request Professor Basanti Goswami to welcome the gathering.
Good afternoon, distinguished resource person, guests and participants, parents, teachers, and my dear students. First and foremost, on behalf of Darshan College, Bangalore, I take the privilege and extend a hearty welcome to our resource person, Dr. Manjulata VR, MBBS, DNB, FMAS, obstetrics and gynecologist, laparoscopic surgeon, infertility specialist. Welcome, ma'am. I welcome our Honorable Director, Reverend Father Roshan Rosario, and Honorable Principal Joy Wilson D'Souza for this webinar. Welcome you, fathers.
Thank you, ma'am.
Next, I welcome all the participants from various states for making your gracious presence. Welcome, everyone. Then I welcome our Darshanites and their dignified parents for the webinar. I welcome all. I welcome all the non-teaching and teaching fraternity. Welcome all to this webinar. Once again, I welcome one and all. Thank you.
Thank you, ma'am. Now I request Professor Sneha R, Department of Computer Application, to introduce the resource person.
Good afternoon, everybody. It's a great pleasure for me to introduce our resource speaker, Dr. Manjulata VR, who is going to talk to us about awareness of polycystic ovarian syndrome in women. Dr. Manjulata VR is a well-known obstetrician and gynecologist in Bangalore. She is specialized in female reproductive system and committed towards tackling any health issues of women. She aims at improving and guiding on female reproductive hygiene and safety. Dr. Manjulata VR did her MBBS from Sri Siddhartha Medical College, Tumkur. Post-graduation master degree, DNB in obstetrics and gynecology from Sagar Hospital, Bangalore, and fellowship in minimal access surgery from World Laparoscopic Hospital, Delhi. She has published many international and national journals and presented webinars and conferences. Dr. Manjulata VR has provided several obstetric services like management of high-risk pregnancies, normal delivery, cesarean deliveries, ovarian drilling, gyno-laparoscopic surgery, etc. She has been providing a ray of hope and a joy to a lot of people through IUI treatments. Dr. Manjulata VR is a consultant at various leading corporate hospitals at Bangalore. She is well-experienced gynecologist who has a rich experience professional of more than 13 years in their field. Currently, she is consultant at Astra Super Speciality Hospital, Kunte Cross, Bangalore, and Kriti Women's Clinic near Devegoda Petrol Bunk, Bangalore. Her motto is to provide the best quality and affordable treatment for all the women of any age and stage. Please join hands to welcome Dr. Manjulata VR, who accepted our invitation in her busy schedule. Welcome, ma'am.
Thank you, Sneha.
Thank you, ma'am. Without wasting the time, let's start the session. Now, I request the resource person, Dr. Manjulata VR, to take over the session. Over to you, ma'am.
Yeah, thank you. Thank you, Sneha, for the elaborate introduction. Good afternoon to all the wonderful women present here and also the esteemed faculty of Darshan College. And thanks for granting me this opportunity to talk on this day and share awareness about PCOS. So quickly, we'll go into the presentation. You can just tell me if you can see the screen. I'll just share it now. Yeah.
Yes, ma'am. We are able to
Yes,
see.
ma'am.
You're able to see, right? Okay. So today we will discuss about polycystic ovarian syndrome, which is the most trending disease among deficiency or disease or syndrome among all the youngsters right now. So it is also a point of concern for many women, probably because of the changing lifestyle, changing diet, and all those things. So let's quickly look into and understand what exactly is polycystic ovarian syndrome and how well we can deal with it. Okay, right. So what exactly is polycystic ovaries is? Let me tell you what are ovaries. Now, this is the female reproductive system, wherein I hope you all can see it. Okay.
Yes, we can see.
Yeah, right. So now this is the uterus, which is in where the pregnancy happens, where the menstruation happens. These are called the fallopian tubes, and these are the ovaries. A normal ovary should look like this. This is a normal ovary of normal size. In polycystic ovaries, what happens is the ovary becomes like this. There are multiple fluid-filled spaces in the ovary, and it is bulky, due to which it doesn't function properly. So there are women who can have only polycystic ovaries and not have the syndrome. We'll come to what a polycystic ovarian syndrome actually means. So this is polycystic ovaries. So a woman who does not present with polycystic ovarian syndrome and only has polycystic ovaries has a lot of scope for improvement and to avoid the syndrome. Now let's look into what the syndrome is. We call it a syndrome when these polycystic ovaries on ultrasound are associated with changes in periods, changes in hormones, as well as the general appearance of the women changes. Like she might have acne, she might have abnormal facial hair growth. So when polycystic ovary is associated with either 2 or 3 of the following, then we say that she has the syndrome. If she has the syndrome, it means she has to consult a gynecologist and get it cured as soon as possible, because otherwise what will be the implications, we will see it a little later. Okay, so how often is polycystic ovarian syndrome seen in current scenario is it affects almost 2 to 26 in every 100 women. This is very less what I'm saying, but recently of late, because of the changes in food habits and lack of exercise, we see it in almost every 5 women. 1 in every 5 women has this problem. Right. So what exactly are the symptoms of polycystic ovaries, in case of which you must get alarmed, right? Okay, I am having some problem. Let me consult the doctor immediately. That is irregular periods. The women we typically call, she will have less than 3 periods in 1 year. That is 3 months or 4 months once is what will be her regular bleeding. Whereas a normal women's cycle should be anywhere between 21 days and 35 days. That is, it should not happen before 21 days and it shouldn't be crossing 35 days. In between window is completely accepted. So in that case, and even polycystic ovarian syndrome ladies can have no periods for 6 months, 8 months, also at a stretch. That is also a possibility. Next, coming to the increased facial or body hair, they will have abnormal hair growth on the chin, upper lip, excessive hair growth, body hair growth, which is called hirsutism. That is also a very, very classical sign of PCOS. Then there will be loss of hair. There will be balding, sudden hair loss. That is also one of the features. Then overweight. This overweight, people who are overweight can also get PCOS, or by PCOS itself can cause overweight. Both things can happen. The other thing is oily skin and acne. They will have a lot of pimples and thing on the face. The skin will be very oily. Reduced fertility in women who are of reproductive age group, that is, who are married, who are expecting children, can have difficulties in getting pregnant, and even after getting pregnant they can have high blood pressure, high diabetes. All these are problems with PCOS with pregnancy. Because of all these problems, they can go into depression and have psychological problems. Though PCOS per se does not cause depression or psychological, it is because of all these reasons that the women feels low self-esteem. Okay, so these are this is typically how a PCOS women will look. There are lean PCOS also. The lean PCOS also will have these problems like acne, hair loss, hirsutism, and all these. And this will be the typically monthly. This is how they will bleed. They will have hardly any bleeding. 3 to 4 cycles in a month is what they will have. Right. So, what are the causes of PCOS? PCOS, generally, there is no cause for PCOS, but to some extent it is familial. Like it can run in families, like how diabetes and high blood pressure runs in families. PCOS also can run in families, but that is to a very, very small extent. Large extent of it is because of lifestyle, either improper diet or lack of exercise. These are the 2 main causes, and this can definitely be corrected with some effort and consistency. We'll talk about it a little later. Coming to the diagnosis of PCOS, how generally the physician knows that you are affected with PCOS is, this is a definite finding. Irregular periods or no periods at all, increased body hair. And to check this, we will ask for a certain hormone levels in blood, and that depends on what age the patient is and what she desires. She desires only regular period, or she desires to get pregnant. It depends on all that. We ask for certain hormone levels. And ultrasound. Ultrasound is the best diagnostic modality wherein, as I showed you before, there will be polycystic pattern in the ovaries. What are the consequences of PCOS? These are the short-term consequences of PCOS, irregular menses, and as I already told, there will be hirsutism, acne, hair fall, and infertility and obesity. This is only tip of the iceberg. When you see this, in order to prevent the long-term consequences, which we will see in the next slide, this should be an alarm for anyone. If there are 2 to 3 of these symptoms, then yes, immediately work on how to revert back from PCOS. Now, these are the long-term consequences. There can be insulin resistance. It does not reduce the level of insulin hormone, but definitely makes the insulin resistant so that it does not act with the glucose and that goes and gets deposited as fat in the body, and also causes glucose intolerance or what we call diabetes mellitus and hypertension. So over 5 to 10 years of uncorrected PCOD can cause all these problems. Why hypertension? Due to the same reason, the stress levels and glucocorticoid hormone levels increase, due to which the women tends to have high blood pressure, and endometrial cancer because whatever the endometrium is accumulating inside the uterus is not coming out. It goes on accumulating over 3 months, 6 months, and that is a potential cause for endometrial cancer. It can turn to cancer. Depression and mood swings, definitely over the long run. If the woman doesn't menstruate, she has obesity, she's definitely going to have mood swings and depression. And snoring and daytime sleepiness is also one of the causes. Though thyroid is another cause for snoring and daytime sleepiness, we will be evaluating all those things when you come with complaints of polycystic ovarian syndrome. Coming to the treatment aspect. So I wouldn't say there is a cure to PCOD because it is a lifestyle disease. You take all these medications and don't exercise, don't diet, then it is not going to cure your PCOD. So what we can do in PCOD is just a symptomatic treatment in the sense, now if you don't wish to have pregnancy, then you will be put on contraceptive pills. Now what the ovary does, ovary secretes certain hormones. One hormone where the endometrium builds up, another hormone for its shedding. The imbalance between these two hormones, estrogen and progesterone, is the main cause for PCOS. So what we do here is we give combined estrogen and progesterone pills, which are 21-day pills. We are just replacing the work of ovary. We are not curing the disease, but we are making it regular so that the long-term complications do not happen. But the problem with these pills are they have a lot of side effects. We cannot continue it more than 1 year. So that's the max. Probably you can only take it as time to reduce weight and time to correct your hormonal imbalance with diet and exercise. Then we give metformin because of insulin resistance. This metformin reduces the insulin resistance and helps in the breakdown of glucose so that we can prevent diabetes mellitus. Same way, whatever it is, medicine is medicine. What comes naturally comes naturally. Spironolactone is another, we call it a diuretic. The reason we give that is spironolactone, what it does is the main hormone, the testosterone, will be more in PCOS. What the spironolactone does, it does not help in conversion of testosterone. It blocks the testosterone receptors so that the main hormone effects on the women is less. So weight reduction, even 5 to 10% of weight reduction can cause a huge difference in symptoms because it is even 1 kg or 500 grams of weight loss can help your PCOS to a great extent. Now, if the woman desires pregnancy, then yes, there are ovulation induction drugs because the women with PCOS will have anovulatory cycles. That is, the eggs which she produces will not be of good quality. So what we do to improve the quality, we give certain medications so that she has a good egg production and she conceives normally. So this is all about the management. So the best management is again healthy, balanced diet. See, there are a lot of apps which you can use, which will track your calories and you can cut down on your calories. And also You can follow something called intermittent fasting. Probably we can elaborate this some other day. Basically, whatever you consume, every meal should have 30% of raw fruits or raw vegetables. That is a dictum. And 3 meals, don't try to have anything in between your meals. The meals can be moderately heavy and not extremely heavy or extremely light. Moderate meals, 3 meals, and try to maintain the meal timings. Do not have at 1 o'clock one day and 4 o'clock one day. That also changes the balance to a great extent. And every meal should have 30% of raw fruits or raw vegetables. So this is just a gist I've given you about what a balanced diet can be. And another very important thing, what most of the youngsters have today is anything with Ajinomoto. All your packeted chips packets, all your processed food like noodles, instant noodles, which comes with taste maker, anything you buy from outside, like it can be gobi, fried rice, or Chinese or North Indian, anything you buy from outside has a content called monosodium glutamate, also called commonly as Ajinomoto. This has a big contribution towards polycystic ovaries. So please do not consume this, that can change polycystic ovaries to a great extent. So regular meals and regular exercise. So in regular exercise, even a 45-minute of walk can do wonders. So I think I have covered the basic of polycystic ovaries. In case of any queries, we are open to discussion. Hello.
Any questions, students?
No questions.
Anybody, any questions? Any questions from the... Ma'am, I have a question. Is PCOD, is it genetical, hereditary sometimes?
See, sometimes to a very, very small extent, it can be hereditary. Very, very small extent, it can be hereditary. But definitely it can be corrected. It's not that, it's hereditary and you don't do anything about it. It can definitely be corrected. Doesn't have to be hereditary always. Even diabetes, blood pressure, all that also comes hereditary, right? But we can definitely change it.
Any questions, students, participants?
No, ma'am.
Good afternoon, ma'am. I'm Vasundhara. I would like to pose a question. That is hypertension is main or one of the important cause for PCOD or PCOS?
What is the important cause, is it?
No, is it one of the main cause or major thing because of hypertension? Is it possible?
No. See, hypertension does not cause polycystic ovaries. Polycystic ovaries, if not corrected over 10 years, 15 years, can cause hypertension. Polycystic ovaries can cause hypertension, diabetes, increased cholesterol levels, all those things. They don't cause polycystic ovaries.
Thank you.
Ma'am, I'm having a doubt.
Yeah.
Ma'am, not about PCOD, but in general, one of my cousins, she took vaccine during her periods, a second dose of Covishield.
Okay.
Now she's facing late period, it seems. So what she have to do now? Is there any need to consult a doctor, like gynecologist?
No, see, taking vaccination and having a delayed period could only be a coincidence. I wouldn't say that because of vaccination she's having her delayed periods. So it could have coincided. So she can consult a gynecologist or get a scan done, or wait for a couple of periods. If it continuously is delayed, then she'll have to consult.
Okay, ma'am.
She can observe for 1 or 2 cycles. No, nothing, no harm.
Okay, ma'am. Thank you.
Ma'am, there is one more question. Here, pre-menopause symptoms, ma'am. What are the symptoms of pre-menopause?
See, pre-menopause in the sense we call it perimenopausal age. That is starts between 3 to 5 years before attaining menopause. So that even that time the women faces irregular cycles, but she will not have the other things which I mentioned. So she will have a monthly, 3 months or 4 months once they will have period. That is because the endometrium does not build in them. In PCOS, what happens? It builds, and it does not come out, due to which all these problems. But when she is attaining menopause, she builds very less endometrium. For a normal endometrium to build itself, she takes 3 to 4 months. So theirs is a totally different problem. Only this irregular period symptom is same between PCOD and perimenopausal age group. Or rest of the problems they will not face.
Ma'am, there is one more question. A girl is facing irregular periods, ma'am. So when she should get to the scanning of this PCOD, whether it is there or not, ma'am?
See, she can wait for 6 months.
Okay.
In 6 months, if she does not bleed even twice,
okay, ma'am,
then she definitely has to consult. 6 months they can wait, because any stress that time they would have had stress, or they could have had exams, or they could have had some junk that time. So that cycle and the next cycle can be delayed. But 6 months continuously she is having delay in cycles every time, then it has to be looked into.
Ma'am, one more question. Another girl, she has a menstruation problem. So like she gets her periods once in 2 months or once in 3 months, ma'am. So how this actually it will get resolved?
See, that's what first she can try lifestyle changes. Like she can start walking. Definitely when the woman first time faces all this, she would be doing wrong in one of the two things, either diet or exercise. It might be a lot of junk and outside food, or lack of exercise. Absolutely. Now, because of this work from home, people are sitting in front of the system for long hours, absolutely nil physical activity. So things like that, they can change these things. They can start walking, they can start a 45-minute walk, start having fresh fruits and vegetables, cut down on outside food completely, and they can observe for 2 more months. Even after those 2 months, it is not coming down, then medical help is definitely needed.
Ma'am, the last question here. Can you please suggest the diet plan for PCOD?
Yeah. The diet plan, it depends on the individual. Now, assume I suggest a diet plan. I do a blood test and the woman has thyroid problems. How will I give a diet plan without checking the hormone levels? So there are a few basic hormone levels which has to be done in a woman with PCOS. We see those hormone levels, match it, and then give the diet chart. The diet chart is not same for everybody. Some people can stay without eating for 8 hours. Some can stay for 16 hours. I cannot tell uniformly everybody follow a 16-hour fast and an 8-hour eating window, right? It depends on each individual. So you have to be examined, your weight, your BMI has to be checked, ultrasound has to be done, few hormones have to be done. Based on that, the diet plan is different for every woman. Every body is different, right?
Yes, that is true.
Ma'am, one student have a question. What is the difference between PCOD and PCOS? That is the question from a student.
It is nothing but polycystic ovarian syndrome is PCOS. Syndrome is when it is a combination of 4 to 5 symptoms, we call it syndrome. Even with one symptom, we call it a disease, polycystic ovarian disease. That's all. But now the terminology of PCOD is almost gone. We use polycystic ovarian syndrome only. That's the right word. Both are technically, for you all, technically it's the same.
Ma'am, what if a person face periods thrice in a month?
Yeah, see, irregular periods in the sense in polycystic ovaries, it does not mean once in 3 months or once in 4 months. They can have periods every 15 days also. Even that can happen in polycystic ovarian syndrome. That is why I told it should cross 21 days and it should be less than 35 days. More than 21 days is normal. Less than 35 days is also normal. So 15 days once is definitely a concern. I wouldn't say monthly 2 periods is a concern, because the women can have period on 1st of Jan and also have on 23rd of Jan. So she has crossed 21 days, but still it is 2 cycles in a month. I will not treat her saying that she had 2 periods in January. I would reassure and send her home because she has crossed 21 days and then had her period. 15 days once period is definitely a concern. It should cross 21 days.
Ma'am, a student have a question.
Mhm.
Side effects of delay in periods. What are the side effects of delay in periods?
See, that's what I said. As we discussed in long-term side effects of PCOD, when you have delayed periods in PCOD, what happens? The endometrium, the lining of the uterus, keeps on accumulating. It increases. That can cause hormone variation. When the endometrium accumulates like that, it can have an insulin resistance. So your glucose levels, blood glucose levels can increase. It can increase certain hormone levels, which can cause high blood pressure. And the endometrium keeps on accumulating over 10 years. You have periods only 4 months, 5 months. Then after 10 years, you are at high risk of endometrial cancer, or because of those cysts in the ovary, it can also turn into ovarian cancer. That is over a long term. Recent, small, immediate side effect is just irregular periods. That's all. But long term side effects are many. That is the reason PCOS is always of concern. When you get irregular periods, it's like an alarm. Okay, you have irregular periods. Come on, what way we can do about it? And when one woman in a family has PCOS and she has irregular periods, she can change the entire family's lifestyle and diet to a healthy lifestyle and diet. That is the advantage of PCOS. So if anybody has irregular periods or anything, start your lifestyle changes. The entire family can follow what you're following. So everybody is benefited. So take it as an advantage and get treated quickly.
Okay. We have one more question. A girl come to a puberty, and her periods are regular for 1.5 years to 2 years, and after that she starts having irregular menstrual, like a day or a month or a week change delay in their periods. Do you think this will this will affect for the long time, or she may have even a regular menstrual as she was having previously? That was the question.
Okay, see, now what happens is women have started menstruating at 10 years and 12 years. We are seeing very early menarche these days. That is, puberty is coming almost 1 to 2 years before at what age it used to come. It is starting at 10 years, 11 years and all. So such women, again, when they are below 18, below 19, they have an ovulatory cycle. The ovary is not ready yet to produce egg. Only when it starts producing eggs, they will become regular. So when a woman has just attained her puberty, she can easily wait for 3 years to 4 years for the cycles to get regular. She does not have to get tensed. Similarly, she also should avoid junk food, not too much of junk food. You can keep it to maybe 15 days once. something like that. Once she has corrected all those things, even if she has irregular periods, she can definitely wait up to 3 years, because body takes that much time to get regularized. Puberty is a new change in her body. We can give until 3 years time for the body to get adjusted. So there's no need to panic in that case, unless and until she is losing a large amount of blood every cycle. That is a concern, because she will become anemic. That has to be addressed. But if she's having normal period and it is happening 1.5, 2 months once, it is okay. You can wait till 3 years.
Hope you're getting the solutions. Ma'am, we have one more question. How to reduce period cramp? How to reduce period cramps? There is any, like, how to reduce period cramps, to any tablets or like any like you have home remedies?
Yeah, see, the normal regular antispasmodic, regular antispasmodic painkillers can be taken. Unless and until it is 2 tablets per day, it is still okay. Some people till they get pregnant, they will have these cramps, and after delivery it is known to reduce slightly. But if these cramps come hereditary, then it will persist. We cannot do anything about that. If the woman has pain, it means that she has started to ovulate. She's having healthy cycles. But that pain, other than taking painkillers, there is no other way to come down on that.
Hope you got the solution, those who asked. And we have one more question. I think Sheetal, can you ask? I'm not able to understand that. Can you please ask the question, Sheetal?
Good afternoon, ma'am.
Yeah, ma'am. Good afternoon.
Ma'am, is having acne is the main symptom of PCOS?
Sorry, is acne? Yeah, it's definitely one of the symptoms. Definitely one of the symptoms. See, basically, when there is PCOS, what happens? There is a lot of testosterone, which is a male kind of hormone in the body. And the testosterone is the reason for acne. So that is why when we give medicines for PCOS, if the woman is having PCOS as well as acne, we give a drug called spironolactone. What it does is it stops the action of testosterone. So eventually she will have less testosterone and the symptoms of acne will clear up slowly. It is not that always acne is related to PCOS. Again, acne can be because of naturally oily skin or hereditary. But definitely PCOS, one of the symptoms is acne. It's not the vice versa. Acne is not always PCOS. Yeah.
Any questions you can ask? One more question is there. Before having periods, some of my neighbor, they get cold, cough, then it turns to a period. Do you think this really happens, or it is just a circumstance, or it's just coincidence?
No, definitely it's a coincidence. There is absolutely no relevance to that.
Any questions?
Ma'am, one more question from a student, that is, she is getting periods correctly, ma'am. That is, every month she will be getting periods. In spite of that, her body growth is not that much, ma'am. Like from previous 4 to 5 years, how she was, now also she is like the same. So is it?
You mean she's very lean, is it?
She is very lean.
Okay. See, being lean again can be hereditary, and it depends on her appetite and whether she has thyroid problems. In case she has thyroid and it is not treated, even in that case, she can be very lean. She can have very low appetite. It doesn't have to be PCOS.
Okay, ma'am.
If the only problem is being lean, no irregular periods, no acne, no hirsutism, no any hormonal changes, it's only being lean. If she's active, I don't think she has to worry about it. It could be hereditary. Her father or mother could have been this lean at her age. If she has any other problems like excessive sweating, no sleep, or reduced appetite or more appetite, something like that, then thyroid has to be looked into.
Ma'am, one more query. How to reduce acne naturally without any medicines?
No, there is no way to reduce acne naturally. How is it possible? No, that is the nature of the skin, right? The skin is oily. It is secreting a lot of sebum, what we call, and that blocks the pores and it results in acne. So it comes with the nature of the skin. It is not possible to reduce it naturally. Whatever is available in the market, the organic powders or anything, it can do some good. What it does is it temporarily makes your skin a little dry. That's all. But again, whatever oil is getting secreted will get secreted, right? And that sebum will block and acne will come. So it can give a temporary glow to your face, whatever natural packs or whatever you use. But definitely it cannot be. If you want acne to be cured naturally, then you should wait till you're 40 years old. Then it will get cured.
Ma'am, doctor, you have one more question.
Yeah.
Student, I don't know, it's student or participants, dark circle under eyes. So how can you, like, they're telling how can we avoid that? So
dark circles under eyes, huh?
yes.
Okay, again, this dark circles under eyes is a beauty tip that I have to give you. It is not related to PCOS. Get good sleep. If you're not having 8 hours of sleep, please sleep at least for 8 hours. Have a lot of fresh things. Cut down on your non-vegetarian food. Have a lot of vegetarian food which are fresh, and avoid your junk food, and get good sleep and reduce your stress levels. Meditation can help you in one way to reduce your stress levels. That will automatically get your dark circles down. And please do not see phone. The more you see your phone, the more that screen light is going to affect your eyes, block your blood. Do yogasanas, do sirsasana, that will improve your blood flow around your eyes, and your dark circles will come down. Your skin and your dark circles is nothing but it signifies how healthy you are. You're going to get dark circles if you're not healthy from within. If you have to be healthy from within, follow all the healthy lifestyle measures, then it will go on its own.
We have one more question. If we have water bubbles in our ovary, how can we get rid of it?
I think that's what we discussed all this while. Water bubbles in the ovary is nothing but polycystic ovaries. And as I said, lifestyle changes. And if the woman is desiring fertility, sometimes what we do is we do a laparoscopic surgery and do what is called ovarian drilling. What we do, we drill fill those water bubbles and remove the water out so that the healthy ovary is restored and good hormones produce and the women has good cycles. Again, you go in, you do a laparoscopy, burst all the water bubbles and don't do anything about your diet and anything about your exercise. In 6 months, the holes will close again and water bubbles will form again. So though it can be an immediate measure to correct your cycles or to get pregnant, it is not a permanent measure. Within 6 months, it will come back again, it will close again. So the best way is diet, exercise with the help of other medications.
We have one more question. Is it difficult to get pregnant naturally having PCOS?
Definitely not difficult. If 100 women have PCOS, at least 70 to 80 can get pregnant naturally. It's not a dictum that PCOS women will have infertility. If PCOS is associated with fertility issues, then there are treatments for that. But definitely natural conception is not at all ruled out. She can conceive naturally.
We have one more question. Is it dangerous to use menstrual cups for long run?
Yes, it is. See, anything you insert into your body is not good. As much as possible, go with pads because they are something which is placed externally. Menstrual cups, your tampons are something you insert into the vagina. Anything you insert into the vagina over the long run, it can cause dryness. It can injure your cervix, which is the mouth of the uterus. So it is not always recommended unless and until you are allergic to pads or you have too much flow that pads cannot handle it, then you can use cups or tampons.
Any other questions? And we have posted doctors visiting hours and visiting clinic and hospitals. Like if you feel uncomfortable here, you can just visit her, or any age women can visit her. We have already posted that. Okay. Then any other questions? Any other questions?
No, ma'am.
No more queries, ma'am.
Okay, thank you. And thank you again for giving me this opportunity to share this information. So any doubts, anything, you can always feel free to contact.
Definitely, ma'am. Thank you very much.
Thank you very much. So I think many of you have got benefited out of this. If you have any queries, you can just post or you can just contact doctor. Okay. Feedback forms link will be posted and it will be activated only for 3 hours in the chat box.
Thank you so much, ma'am. Now I request Reverend Father Joy Wilson D'Souza, the principal of Darshan College, to address the gathering.
So, good evening, everyone. At the outset, I would like to thank Dr. Manjulata VR for being the resource person to this session. I'm definitely sure that all of our students, all those participants have benefited from this session. And I would also like to wish you all today, as we celebrate National Girl Child Day, definitely all of you are taking up great responsibilities, maybe in the family. So I wish you all the very best and pray for you all. Definitely, today we see that health is very, very important. Health is the primary thing that each one looks forward. We see that due to the pandemic, we have realized more emphatically that if there is no health, no matter what the position that we hold, no matter what the status that we have, no matter the wealth that we have acquired, nothing is useful if we do not have good health. And definitely this session has been beneficial for all of our students. So I'm very grateful to Dr. Manjulata ma'am, and also to Sneha ma'am as well as Basanti ma'am, who have been the coordinators of the Women Empowerment Cell of our college for organizing this session. I'm sorry I couldn't attend the entire session. I was not present because I had a short meeting, sudden abrupt meeting. So because of that, I had to attend that. I was not the part, but still I'm sure that all the participants, especially all the students, have benefited and gained a lot. So thank you very much, ma'am, and thank you one and all for being the part of this session. Thank you.
Thank you.
Thank you, Father. Now we have come to the end of the session. I call upon Dhanushri of 3rd Sem BCA to propose vote of thanks.
Good afternoon, one and all present here. Myself, Dhanushri of 3rd Sem BCA. It's my privilege to propose a vote of thanks on this beautiful occasion. First, I thank the resource person, Dr. Manjulata VR, for gracing this event, giving very helpful information and sparing your precious time with us. Thank you, ma'am. I thank Director of St. Anthony's Institution, Reverend Father Roshan Rosario. Thank you, Father, in his absence. I thank Principal of Darshan College, Reverend Father Joy D'Souza, who always graced us with presence and guidance. Thank you, Father.
Yeah,
I thank our coordinator of Women Empowerment Cell, Professor Sneha R. and Professor Basanti Goswami. Thank you. I also thank our beloved faculty members. Thank you all. I thank my companions of today's event, making it a successful one. Thank you. I thank all participants for gracing this occasion. Thank you one and all.
Thank you, Dhanushri. Thank you all.
Thank you all for being with us. Have a great time.
Sneha ma'am, you are the host. I think you can end the meeting.